Hello everyone, my name is Li Jun Wang, and my professor is Mengcong Zeng. We are from National Taipei University of Technology, and I'm delighted to be here today to talk to you about my research. The topic is the information architecture of PDAs, its impact on user comprehension and risk perception. First, I would like to give you some background information about my topic. Obesity is a major global health challenge. The World Obesity Federation estimates that the number of obese individuals worldwide will reach 1 billion by 2030. This will lead to an increase in related disease and healthcare spending, predicted to exceed $1.2 trillion per year by 2025. Studies show decision aids for obesity are widely used to help physicians explain treatment options, but patients may struggle to understand medical information for several reasons. For example, poor health literacy and low numerical skill. Consequently, medical information should be categorized, named, and hierarchically differentiated for optimal comprehension. And there are currently many different ways of arranging the data narrative of content in the information architecture of decision aids. There are two main types of data narratives in decision aids, which are called author-driven and reader-driven attribution. The author-driven narratives is a linear sequence that is good for delivering a large amount of information, but not very interactive. On the other hand, the reader-driven narratives has no prescribed sequence and is highly interactive. The researchers are unsure which type of data narratives is more suitable for use in obesity decision aids. Therefore, this study makes a hypothesis that different information architecture will affect patient comprehension and risk perception with different numerical scale. Here's my research method. My research method includes a questionnaire survey, semi-structured interview, and a user interface evaluation. Participants aged 20 to 85 years were selected, and we used Berlin numeracy test to test participants' numeracy skills, NASA text load index to measure participant cognitive load, and use system usability scales to test the aid's usability. For this study, we designed two prototypes, Prototype 1 and Prototype 2. Prototype 1 is author-driven and features a linear sequential sense for massive information delivery. Participants are required to view the risk and side effect comprehension chart for each medication, including icon array, pie chart, and bar charts. While Prototype 2 is reader-driven, highly interactive, and has no prescribed sequence. Participants can freely choose the medication and chart type and switch between risk and side effect comprehension for different medication. The step of my experiment: first, we invited participants to provide their basic information and complete the Berlin numerical test. Next, we asked them to perform test scenarios. Then, we asked them to answer comprehension and risk perception questions, as well as complete the NASA TOX and SUS questionnaire. Finally, we conducted a semi-structured interview. The entire experiment took about 30 minutes to complete. The results of my research are as follows. We invited a total of 38 participants with an average age of 26 years, ranging from 21 to 58 years old. Of these participants, 25 were males and 13 were females. Based on the result of the Berlin numerical test, we found that 29 participants had good numerical skills, while 9 participants had poor numerical skills. To measure participants' comprehension, we used 5 questions, C1 to C5. After analyzing the result using the chi-square test, we found that the reader-driven participants had a significantly higher level of comprehension than the author-driven participants, and the p-value is 0.025. However, the result revealed that there was no significant difference in participant risk perception when they are asked to rank the risk of 3 different medications. In terms of overall usability score, the author-driven prototype had a higher score than the reader-driven prototypes. However, both prototypes still score below the mean system usability skills value. In the cognitive load, the results showed that participants experienced higher cognitive load while using their reader-driven framework, especially in the time pressure section. The study found that both prototypes had a similar result for comprehension and risk perception, regardless of numerical skills. But participants with good numerical skills, the reader-driven approach was better for comprehension. At the end of the semi-structured interview, the participant preferred the reader-driven approach because it was easy to compare risk, but it required more information load. On the other hand, the author-driven approach had a low reading load due to step-by-step guidance, but it was difficult to compare drug risk. Let's now discuss the main points. The study found that information architecture do not affect patient risk perception and comprehension, regardless of their numerical skill. However, the reader-driven approach was better for comprehension. The result might be due to the small number of participants and because they weren't actually obese. More research is needed to confirm this finding. In conclusion, our study showed that the design of patient decision aids can affect how well users understand the information. Therefore, future development of these aids should take into account user numerical ability. Here's my presentation. Thank you for attention.